So our conversation, again, is really focusing today on sustaining prevention programs by demonstrating impact. And that's kind of the key approach here is to think, how can we make that connection between the impact that you're having and the funding that you need to continue to do great community work. So I referenced before here, this is kind of a scorecard that we did in the last session. You can also check it out here or use that QR code to access that scorecard. It's a useful tool to kind of give you some feedback on some ways you can make improvements in your organization. You've done kind of a bit of an introduction, but I will share as a background to this that I do consulting work with behavioral health organizations and try to help those organizations be able to demonstrate impact in different ways. A lot of that focuses on things like program evaluation, doing community needs assessments, surveys and focus groups and interviews, things like that for prevention organizations who need that information to guide their practice. Love to do all things related to data. And then in turn also try to find ways to make that data useful when you're communicating with funders. So things like reporting back to SAMHSA or CDC or some of the other federal grant agencies that might be supporting your work. Maybe sometimes it's more of a state or local level where you're trying to do some of that work. And it can be a little bit unwieldy. And so I try to help organizations do that. And I bring that perspective to the conversation that we're going to be having today that's going to focus on trying to communicate that in different ways. So today our objectives are going to be focusing on common challenges in translating outcomes data into funding and sustainability narratives. And this is one of those things that it can be really challenging for organizations to do. So we're going to walk through a little bit what that looks like. We've got 5 different lenses or strategies for communicating community impact. We've got a worksheet that kind of outlines those, and we'll kind of walk through some of those ways and how you might use them strategically to resonate with different types of funders who support your work. And then we'll also talk a little bit about how we kind of evaluate programs in terms of value and investment and long-term sustainability. And we're going to walk through a few examples of cost analysis that I think can be a really helpful lens, especially for people in prevention, because we know so much of the research shows that engaging in prevention, some of those, to use a public health term, upstream factors can have all kinds of economic benefits because we're preventing problems before they begin and get worse and also more expensive. And then we'll talk about a few practical steps that you can take to improve your organization's funding narrative and positioning. Now, all of this kind of comes from a framework, a funding framework that is called the Clarity Impact Funding Framework that I use with many of the clients and organizations that I serve. And I'll walk through this. We talked about it a little bit last week, so I'll go kind of quickly today, but I want to get this frame in the back of your mind as we're going through our conversation for today. The idea of this framework is that there's 3 key pillars to your organization being able to sort of really run effectively, like a well-oiled engine, I guess to say, or just a really an organization that's highly functioning has these pieces in place. And the first is a sense of strong clarity, right? So as an organization, you have the ability to engage many of these things you've seen before, logic models, theories of change, community needs assessments, things like that, KPIs and outcomes. The idea here is that you have a really strong understanding of the very specific problem or challenge that you're addressing in the community and exactly how you're going to address it and then how you'll measure that success. That's what that clarity section is all about. And this goes above and beyond missions. All of you on this call could probably talk about the mission of your work. Everybody knows what it means to be a prevention specialist or program coordinator or something along those lines, or a leader of a prevention organization. But sometimes what specifically we're trying to work on and specifically how what we do addresses that challenge at a local level can sometimes be more challenging. So that's the first thing that you want to be thinking of. And as you go through that process, the key here is to have a very clear sense of what those outputs and outcomes look like. What are the ways you measure success, and then in ways that can show that you're having that impact on that problem that you've identified. The second part goes into impact, which is where you're out there, you're delivering programs and services, you're engaged in media campaigns, you're doing advocacy, you're holding town halls, all the things that prevention leaders do. And through that process, you're going through a rigorous process of documentation, basically saying every time you're doing something, you're finding some way to document and capture that so that you can communicate it to someone else. And the reason why that's so important is because, especially in prevention, sometimes people don't fully understand your work. Maybe you understand it in your as a person who's been working prevention for many years. But when you go talk to somebody who doesn't know about prevention or hasn't maybe collaborated with a prevention organization before, they might not fully understand it. And this impact piece is able to then be able to document that work and be able to share and communicate that in really important ways. And that leads us to our last one, which is on funding. Now, one of the challenges that will happen is that many organizations have a pretty good sense of what they're doing and are gathering some data to try to demonstrate that impact of the work that they do. But they fail to kind of get to this third loop, which is how do you then translate that impact that you've generated into important and meaningful funding narratives that resonate with grantors, with at the federal, state, or local level, with community foundations, national foundations, individual donors, and other people who could be important stakeholders to supporting your mission. And you've probably seen a lot of these before, things around storytelling, testimonials, communications, marketing, advocacy, all those kind of pieces, having members of your organization engage in thought leadership activity, whether it's writing blogs or speaking at local events or at conferences and things. And then, of course, the place where we get to that direct ask of grant writing and donor stewardship. These pieces, sometimes what will happen is that in an organization, either no one's doing it or someone is doing it, but that person might not be as connected to the prevention work that you're doing. And they're trying to tell stories and gather information and testimonials, but they're not necessarily experts in the field. And what happens is that there's a disconnect between the impact and that funding piece. So my hope for today is that we can kind of address some of that gap here to help you as a prevention leader in your organization be more effective in communicating the impact that you do and the value that that brings to your community. Now, we used an example of a bridge last time, that bridge connecting the funding and impact side of things. And we talked about a case example of naloxone. And in that example, we showed how, well, we can talk about the work that we do by counting it, right? So a good way of describing your work, if you do some work in distributing naloxone to prevent opioid overdoses in your community or other ones, you have that way of tracking that by saying, well, hey, we've distributed 10,000 naloxone kits into a community to community members who are at risk of overdose. That's a really great stat, right? That's really good work. But what we want, as we talked about last week, we want to extend that. So a better way of thinking about that is, can you go to the next level and say, well, what did those naloxone kits accomplish when they were out in the community? So if you could, for example, say, we distributed 10,000 naloxone kits and received reports of approximately 350 overdose reversals, saving potentially hundreds of lives. That is a much more compelling way of communicating that impact, right? You're showing that outcome, not just the output of the work that you've done, and immediately connecting that to something that is important and resonates, like saving lives. But I would say that you could even extend that same idea further and say, how can we sort of bring a sense of value to that work that you're accomplishing? So in this case, we distributed 10,000 naloxone kits, resulting in 350 overdose reversals at an estimated cost of about $2,000 per reversal. That's much lower than hospitalization, demonstrating that naloxone distribution is not only the good and right thing to do, but also highly cost-effective and life-saving. So you see how that kind of change happens. The same activity is happening, you're distributing naloxone, but you have this narrative that adds more detail and richness that really explains what you're trying to accomplish and the impact that it's having in the community, and in turn the value that that demonstrates that go above and beyond just the specific individual things. Now, I don't want to assume here that that by assigning cost or value to particular things somehow should supersede the value of the human lives of those we're interacting with. It's not what I'm saying. But I guess what I am trying to say is that there's multiple ways to talk about it and communicate it to resonate with some of the audience members that are engaging with your organization. And if we can think of ways to talk about the same work that we're doing in ways that communicate that value in a way that's going to resonate with a diverse set of stakeholders, it's going to help your organization start to do those things that you know you need to do in our current moment, like diversify funding streams, find different sources of support, and engage people in new ways that maybe will support your organization, not necessarily with funding, but maybe with new partnerships and opportunities that can advance your work. So this problem, as I talked about and alluded before, is this bridge problem, right? Prevention organizations struggle to make that connection between what they do, the impact they have, and the value of their work. And the problem that we're trying to address here is that this results in missed opportunities to gain support and funding to sustain their work. And as you can see, it's kind of grayed out behind here, but we had the analogy of the Bridge of Avignon, which is a bridge that goes halfway into the river and stops. And sometimes it can feel like that's what the work feels like when you're doing prevention work in this way. So for today, what I want you to be thinking about is making this broader shift, a shift in mindset and an approach. Instead of thinking about the work that you do or the impact you have, I'd like you, at least just for today, just for this exercise, to try to think from the perspective of a funder. So that's actually a challenging mindset shift to have, right? Put yourself in the position of somebody who works as a grant officer at the federal level, or sitting in the chair of a community foundation in your community, or maybe somebody who sits on a county commission or a town council that might have some way to interact with or support your organization. Put yourself in that person's shoes and from that person's lens, and then ask yourself the question, we've got a number of different challenges that are important. Which are the ones that are going to have the biggest impact, or that are going to most resonate with the work that or the mission I'm trying to accomplish? And when we do that, when we change that perspective from ourselves to the funder, it helps us to then look back at our organization, almost kind of like through a mirror, or as if you were somehow outside of it for a moment. And you could look down and see, okay, now I can understand where's the true value of this organization within the broader ecosphere of all the different organizations and priorities that some of these funders may be representing. Now, to figure that out, I want to start us off with a fun little poll here. You can use this by just using your phone and doing that QR code, or you can go to slido.com and then just enter in this code 2131653 with this little passcode. The QR code is a little bit more straightforward, so if you got a phone, that's probably the fastest way to do it. And what I'd like to do is just to get a sense of, if I'm inviting you all to think from the perspective of a funder, it's helpful to know from the folks on this call, what are the types of funding resources that are currently supporting your organization? And we've got 5 options here. We've got federal grants, that includes SAMHSA, CDC, and HRSA, some of those larger kind of federal grant entities that oftentimes support prevention work. We also have some state and local grants that might include things like block grant support that you receive, something from a Department of Mental Health, or Human Services, something along those lines. You may also receive support from a local community foundation, something like a United Way, for example, or a local community foundation. And then there's also individual donations. So if you're out there running galas and having Giving Tuesday campaigns, or finding other ways to engage your community, maybe you have a board of directors that provides direct support to your organization as well. And then large national philanthropies at the bottom. So we've got some responses coming in. We got 18 responses already, and we're definitely leaning heavy into federal and state and local grants. As makes sense. That's often what really supports a lot of each of these pieces. Well, we had one person that says, you can only select one response. Oh, it didn't work the way we wanted it to. I'm so sorry about that. Well, just choose one of them then, I guess. I guess you can choose maybe the one that is the biggest if you can't select all that apply. I apologize. I thought that was set up that. So check all that apply. So we got some good answers here. We've got federal grants at 46 and state and local at 46. So we're pretty heavy in the grant space, right? So now for many of you who are doing this, the lessons that we're going to talk today are going to resonate really for grant writers, but also in your kind of traditional grant streams for federal and state support for your organization. But they're also going to help, and I hope that this is useful, help you as you think if you have a need or you see a need within your organization to do some pivoting about recognizing the need to diversify some of those funding sources in your organization, that maybe the conversation today will help you figure out how the ways you've talked about impact to federal and state and local grant resources that you've used before can be used also in different ways to meet different audiences. So we'll talk about that a little bit today. So many people, though, mentioned here that their organization might receive from all, and you might have just put federal or state because it's the largest. So we should recognize that these numbers for local and community foundations and individual donations is probably a little higher than what's being represented here. But it gives us a good sense of what we are working with today. Thank you for the folks who were able to hop on and respond. So let's talk a little bit about, let's go over to our next one. An important shift in that mindset that we were talking about, right? So when I shared that there's this shift that we have to make, moving away from how do we talk about our impact to putting ourselves in the shoes, in the mindset, in the framing of a funder, we kind of make a couple of important mental shifts, right? So our default on the left here is to talk about here's who we are, here's what we do, here's our mission, this is the impact of what we have, this is what we measure, and this is why it's really important in the community. The challenge is that with that approach to talking about the work that we do, it kind of assumes that funders will do some of that translation work themselves. Now, to some extent, that actually works just fine for some state and local grant opportunities because you're sending it to a grant officer who has a background in prevention, right? Who has read the notice of funding announcement in detail and coordinates with some of the grant reviewers and whatnot and really understands prevention work very well. They probably have gone to a training on the strategic prevention framework. They've read some of the great materials from SAMHSA and CADCA and some of the other resources and key national organizations we have that guide prevention work. And so in a sense, you don't have to do much translation work when you're applying for those specific prevention grants. Now, the challenge is that if you want to seek support from organizations that are not sort of in the prevention world and ecosystem like you are and like some of those federal and state sources are, it requires us to think a little bit outside of ourselves to remember that we still have some important translation work to do to communicate the importance and value of the work of prevention and why it's so necessary and important in the community. So a values-driven approach might say, what is my funder trying to achieve? And what are they accountable for, or to whom are they accountable? You know, we often talk about ourselves and how we have to report back to funders, but those funders too have to report back to somebody else, right? Oftentimes it's the source of the funding. If it's a community foundation, it's getting back to the community of people who supported it and said, this is how your money was spent, right? This is what we worked on. Thinking a little bit about the risks they're managing or constraints, you know, there may be some things at a local level, for example, that are really important to be addressing or managing. So say, for example, you're trying to build a relationship with somebody at a county commission level to see if you could do more collaborative work with maybe a Department of Public Health or Human Services at the county level. Well, those organizations oftentimes have people who are in positions that are elected and they're accountable to the public, to the community. And so if there's an issue in your community, let's say, for example, around housing and homelessness issues, and there's concern from residents about maybe an increased presence of individuals who are chronically homeless in the community and feeling like they're not being served, or that there's particular challenges or feelings of challenge or difficulty, or a presence of disorder in their community. And I don't want to say that all members who are homeless would create that by any means, but maybe that's a perception that you have in the public. You'll have an elected official who feels like they need to respond to that, right? And so when you're thinking about positioning your organization to be able to, say, hey, we've got a great prevention work that we're doing, we can address some of these challenges. Maybe the challenge is related to something around youth vaping in schools, or something around maybe a high-profile incident involving alcohol in youth that had some difficult consequences for a community. You can position your organization as someone who can provide the value and solutions needed for someone in position of a public official, for example, to be able to respond effectively to those particular challenges. So the shift then requires you to think, what decision is my funder trying to make, and how can our program offer value in a way that helps them meet something that they want to accomplish? And that's that different mindset or change of focus that we're going to try and focus on a little bit today. Now, I know many of you probably already do a little bit of this part on the right-hand side. I don't want to position this as if people are only thinking about themselves or only thinking about funders. Most of you are doing a little bit of both, and that's what we all do. But for the purposes of our conversation today, I want you to really try to force yourself to rethink the way you do some of your grant writing and some of your donor stewardship, and certainly in relationships with organizations that would fund your work outside of state and federal grants, to think about what are the different constraints, challenges, goals, and interests that those funders might have, and how your organization, who knows prevention well and maybe also works across the continuum of care with respect to things like recovery and treatment and whatnot, that you can go out into the community and be a problem solver with them. So Today, we're going to talk about 5 ways that you can communicate this value. The first of which is going to be economic. And I alluded to this to a little bit in the example of naloxone, but we're going to walk through a step-by-step case so you can see how you might be able to do the exact type of communication and what I described there in your own setting. If you do, for example, naloxone distribution, or you can use that with any other examples. We talked about a vaping one last week too. So the economic one is really going to focus on costs and return on investment. So for every dollar invested in prevention, what is the potential return to the community in terms of dollars and cents? And the key here is oftentimes recognizing that prevention, the argument that you're making, prevention in working with individuals before challenges and problems begin, tend to offset much more costly interventions later on to address social problems. Sometimes you might see those social problems show up in ER visits and hospital bills. They could show up in involvement in the criminal justice system. They can show up in involvement around service members and their time, public servants and their time, and the time that they're now spending to address a challenge that maybe didn't need to be there. It shows up with how law enforcement spends their time. It shows up with how school officials spend their time and how they're using their resources to address challenges in a community. And so when you look at those economic pieces, what you're trying to understand is when you compare prevention, which is a big upstream intervention, to a downstream cost, that you're trying to make the case that the investment in prevention prevents longer term costs down the line. The second is you can look at risk and consequences. So for example, you might say as an organization that you are trying to prevent negative things that could be coming up as a result of substance use in the community. Now, of course, when we're working with youth, we want to be always keeping that strengths-based perspective and that focus on the many things that youth are doing well. But the reality is that when you have an interaction between adolescents and substance use, there are sometimes some very difficult consequences that communities bear. That can show up in terms of auto accidents. It can show up in terms of involvement with the criminal justice system. It can show up in terms of addiction and overdose. And these consequences are important and meaningful to many of those stakeholders out there, above and beyond federal and state grant holders. And talking about those risks and consequences in meaningful ways is another way you can communicate value. Third is around system impact and the burdens and inefficiencies that come when you have some of these consequences taking place, right? So I alluded this to a little bit, but how much time does your law enforcement team spend, for example, addressing issues of disturbances among adolescents and youth in your community, and how maybe they would prefer to spend their time in different ways, interacting with the community, not as the one showing up to break up, a particular incident or a connection or some gathering of youth, for example, but rather having more positive interactions with youth. That's an example of system impact, and it can be really meaningful for some of those stakeholders and partners who wish to see their time used in most effective ways and see your organization as one that can help them accomplish that. Fourth is around strategic alignment, and this is one around being very savvy as an organization to link your priorities and the work of your organization and the mission of your organization to the priorities of the funder. Now, I would never suggest that you should stray from your mission. And so for those of you who are leaders of organizations out there, you know it can always be a little bit of a dance as a leader of your organization in terms of staying true to your mission, but also meeting what a funder is looking for. Here, what you want to try to do is show how the fullest and most wonderful expression of your mission, being true and authentic to yourself, can be very closely aligned to other priorities. And I'll give some examples about what that might look like. And then lastly is around building a sense of community and trust and access and legitimacy in the community. Okay, so those are some 5 ways to communicate value. Now, let's start with the first one. Let's focus on this economic case, right? So the case of naloxone, I gave that example previously. I'm going to walk through exactly what that might look like and how you might communicate that value to a group. Now, for each one of these, I'm going to share with you a potential audience that might be interested in understanding kind of what the what your kind of person you're going to be speaking to ask for some support of some type, whether it's financial or otherwise. In this case, we're going to pretend that you're having a conversation with the county health department that is distributing opioid settlement funds. Right, so you have that OSF funding stream that many organizations and communities that you probably work with or familiar with, or maybe you receive some OSF funds already, will know about, right? So let's walk through some of the math. I gave you those examples before, but I want to show you that this is actually something that you can do kind of in an afternoon if you have the different data pieces in front of you. Let's say that you distributed 10,000 kits in a community. Now I know that's a lot, so that's probably more for a larger urban county, but you could take that and turn it into 1,000 kits if you live in a smaller community, and just take off the zeros on each of these numbers and you'll see how it'll still work. But with 10,000 kits, maybe you know that it's going to cost you $50 per kit to distribute. And so you know that you're going to need $500,000 to accomplish this. Maybe you go out and you find some big grant, get that pool of funding to be able to distribute the naloxone. Now you know you have $500,000 in kits, but to actually distribute 10,000 kits, it's a lot of work. It's a ton of work, right? So you're going to need $200,000 in operations. That's staff time, all the sort of things that go into making it possible to get 10,000 kits from a warehouse out into the community. And so we'll say, okay, that's going to cost us maybe $700,000 in total program costs. Well, you went out there and you found out that from some mechanism that you have internally, that 350 people used those in the past year. So you went out, you distributed them, you waited for a year, and you found out that 350 people came back to your organization and said this was used in a situation where a person was experiencing an overdose. And that likely, had a positive outcome and eventually saved their life, right? Now this is the number that's probably the hardest one to get in this whole episode or exercise that I'm going to show you. But with this exercise, the key here is that maybe you as an organization work really hard to develop trusting relationships with individuals in the community who do use drugs and alcohol. And having that important relationship with the community who is most likely to need using naloxone gives you an opportunity to then gather some information and say, hey, we want to make sure that we get this in the community, keep our community safe. As we go out and gather the support, can you help us by reporting back to us about how it's been used in the community to effectively save people's lives, right? So let's say we get that number, 350 reversals. Well, $700,000 divided by 350 reversals means that it's going to cost you about $2,000 for each reversal to distribute naloxone. So even though the kit costs $50, it's going to cost you about $2,000 for that kit to go out there, to be put in the right place, to get in someone's hand, and to be used in a way that's going to save someone's life. Well, let's say that of those reversals, let's say that half of them would have led to a hospitalization. I'm not sure if they necessarily would. We're just going to use that as a guess number, right? Well, if there was 175 hospitalizations that were avoided as a result of those 350 reversals, and you know that maybe from a local hospital data or from other estimates that you can find nationally, I'm sure you could probably find a number online. I found this estimate kind of in the same way, around $15,000. That for 175 hospitalizations that would be avoided, that would have cost $15,000 per ER visit, for example, which would put a price tag on that of $2.6 million. Okay, so now we have that much money. We know how much the program costs, and we also know how much may have been avoided by not having ER visits. So you can take that larger number, the number of avoided costs, divided by your program costs, and you get this number 3.75, which in turn means that for every $1 invested in naloxone distribution programs is going to generate about $3.75 in avoided hospital costs using conservative assumptions. And voila, you have your cost estimate. Now you can see in here that I did use some estimates, and I think you should be very upfront about moments when you're using an estimate and try to base as much as you can in research. But what I wanted to show you was that you don't have to be an economist or an academic researcher to build a case around value for the work that you do. This is something that is just addition, subtraction, multiplication, right? Which you can do. And your numbers, as you kind of work on this, might change a little bit depending on the type of program and the work that you're doing. But if you can gather some information about the materials that you need to purchase, right? The staff that you need to implement a program, and then you have some type of outcome. In this case, it's reversals, but you could imagine other outcomes, right? For example, dropping out from school avoided, car crashes that didn't take place, any other types of negative consequences, and find some type of research out there that might help you assign a cost to that consequence or outcome. Now, there's research out there that you can find from some economic studies that you could use to maybe gather some estimates on it. There are websites that'll have this, and if you kind of do some good web searches, you can find it. And you might even be able to use some new tools like generative AI and others to help you do some of that research and find out what would a reasonable estimate be to estimate the cost of hospitalizations, for example, or otherwise, that could be helping you and make some of these decisions. So that's how you can get from knowing how many kits you distributed, knowing how many reversals you had, to having a really good cost estimate about the types of savings that your organization can provide. Now, taking a step back, many of you who've been doing prevention work know that, again, as we've alluded to previously, upstream work that is done preventatively can have all kinds of positive cost benefits around more costly downstream outcomes. But it's so much more powerful when you're putting together a grant narrative, when you're putting together a pitch or a talk for a local Rotary, for example, or a county commission, speaking in front of a county commission. When you're doing those types of things, to bring this data as it's your own, data that you have gathered in your local community, responding to your local needs. Because we can all point to research about the importance of prevention, but that doesn't resonate quite as much as specific examples from your community. And going through an exercise like this helps somebody on the other side see the full impact of your work and see exactly how it might have an impact in their community. All right, let's take another one here. Risks and consequences, the case of youth vaping. Here, your audience is the school district behavioral health department. So maybe there'll be some type of behavioral health department or initiative or division inside a broader school district. And so what might be a useful way to communicate value to a school district about youth vaping issues? Well, let's say, for example, that you're implementing a youth vaping program that's going to reach 1,000 middle and high school students, right? And you know that of those 1,000 students, maybe you've done a local survey, maybe you have some other data that you're using as an estimate, maybe you have state level data, and you're saying, when you take that number and you kind of try to apply it locally in your community. But anyways, you come up with the idea that roughly of those 1,000 students, about 220 would report having vaped at least once in the past 30 days. That's what that currently vaping indicator is. Now that would be, about 22%, right? So that's not a small number, right? That would be an important number to be wanting to bring down in terms of prevention. Now, you might be able to say, with this prevention program, we're going to know that only 170 will vape, maybe as a result after engaging in this prevention program. Now, how might you get that number? How do you get from 220 to 170? This is where consulting the research gets really helpful, because what you can do is go to some of these, many of these programs out there. I'll give, for example, Too Good for Drugs, Bachman Life Skills, or others. They're going to be able to show very clearly from the start to the end what are what was the sort of beginning part, and then to what degree or magnitude did you see a reduction in the particular outcome that you're interested in. So you go from 220 to 170 is an estimate that you're thinking will occur if you implement this prevention program with fidelity, and you're basing that on research done in other places on that evidence-based program. Now, so we know that 220 minus 170. We'll say that of the 50 people who are now no longer vaping, let's say that 15 avoid nicotine dependence. And that's kind of, again, using a bit of an estimate to say, like, okay, of those who aren't vaping, not all of them would have necessarily developed, sort of long-term use patterns, and say that 15 are going to avoid dependence. But we know that nicotine dependence, from research again, increases likelihood of problems. Let's estimate 2 to 3 times. So the 15 who avoid dependence, let's say 4 to 5 avoid some of the big behavioral challenges and academic issues and disciplinary events that would cause real big challenges in a school setting. So those with some persistent behavior or academic problems are twice as likely to drop out. So maybe we say that the program, again, so we have 4 or 5, so you're going to present for this twice as many. The program prevents 1 to 2 dropouts per 1,000 students. So that kind of gives you a good sense of what a prevention program can do from start to finish. That notion of what, if we reach 1,000 students, what are the specific types of things or risks or consequences that that program is likely to prevent from occurring. So here we can put it all together and say reducing youth vaping interrupts the progression of early use to dependence, to academic disruption, and long-term life impacts, even when initial changes are modest, right? So that's kind of how you might think about avoiding risks and consequences. Now, I gave the example here of just dropout, but there are other challenges that you could also include in this type of case. For example, you could look at changes in suspensions or expulsions. And the nice thing about that is that you'll have really good data on it because schools are typically required to report on student behavior as a part of their federal regulations. So you should be able to have some available data in your community that looks at suspension rates and expulsion rates in your community. And you might be able to show, after you start running this program for 2 or 3 years, a decrease in some of those suspensions that might be occurring because youth are bringing vaping products to school. So there's more than one type of risk and consequence here. So I don't want you to think that it's only 1 or 2 dropouts, right? But what you're trying to do here is be very, very clear in the case that you're making about what specifically you're going to do and the specific type of tangible result that you could have presented to one of your school leaders. And I think that you'll be surprised to find that if you can avoid 4 and 5 behavioral challenges and 1 to 2 dropouts and start doing that consistently year over year, that would be a huge burden taken off many high school administrators, I would think. So it'd be a good thing to be thinking about. Now let's take our third one, system impact. And let's pretend that you're doing maybe an alcohol social norms campaign. So many of you who are prevention specialists will know a social norms campaign is trying to get information in the community to kind of counteract a prevailing narrative among youth, where youth think more of their friends are using than actually are. And so the idea behind a social norms campaign is that if we communicate that the vast majority of youth are choosing not to use alcohol, which is true nationally in most communities across this country, and that the number of youth using alcohol has been decreasing for 30 years, we might be able to counteract this narrative that for me to fit in or to feel cool or to be a part of my social network, that I have to use alcohol to participate from the perspective of youth. Now let's change our audience here. The last one we had, was the school district. This time we're going to focus on an audience of a local community foundation. And maybe that local community foundation is trying to figure out how to address some community-wide problems. So let's think about ways that you can make a case there that comes from that value lens. So let's say that this community-based nonprofit, your organization, reaches 5,000 local youth through this social norms campaign. It's a combination of posters, it's including social media, graphics and things like that. Maybe there's some paid advertisements, maybe there's billboards. You have the whole communications campaign come together. From a local survey data or from estimates that you're using from state level data that you're applying to your community, that you can estimate of the 5,000 youth that you're going to reach through the social norms campaign, that roughly 1,500 of them currently drink. And then maybe you might estimate that 250 of those are going to make the choice to no longer drink. Now that would be a pretty high number actually for a social norms campaign. It would be like a 15% roughly change in behavior, which would be amazing if you were to have that successfully. But let's just say for now, let's estimate that that might be the case. You can find some research to show what sort of decreases or magnitude changes you might find in an alcohol social norms campaign by doing a little work with a combination of academic research and maybe some use of AI. Now, youth alcohol contributes to community complaints and disturbances, minor law enforcement interactions, and strain on youth serving programs. In some extreme cases, you could have auto accidents or other risky outcomes. And so what you might argue is that of the 250 youth who aren't drinking, let's say that 30 youth are going to avoid some type of community incident. And I listed a bunch of the ones up there, and there could be even others that would be associated with youth alcohol use. Each incident involves program staff response and time. Law enforcement members have to come out and have conversations. You have to coordinate with families. You could be more involved in the justice system. You could be more involved in human services and mental health organizations as well that might get brought in situations like this. But let's estimate that it's about 2.5 hours of people's time per incident to address some of these challenges. 30 fewer incidents then results in 75 fewer hours of community law enforcement and system time saved. So because of this prevention work that you're doing, because of this work that you're doing in the community, you're out there and you're saving people's time so that they can focus on other aspects of their work. So at a community scale, that whole argument, to bring it all together at the end, even modest reductions in youth alcohol use can reduce system burden, freeing up capacity across organizations and improving overall community functioning. All right, I've got 2 more, so hang in there with me. I'm going to walk through all 5 of these, and then we'll have some time to have you guys share some ideas and some thoughts, and we'll do a little bit of practice ourselves on the same exercise. So I've got 2 more. The next one we have here is alignment. And here is the case of maybe something along the lines of a community health assessment or a community health improvement plan. So another audience that you might be thinking about is a county public health department. And you could use county here, depending on your, the area of the country that you live in. It might be more of a region. It might be, that term might be a little bit different, but something smaller than a state. Most communities have some type of community health assessment or community health improvement program. There are some federal regulations that apply to certain types of nonprofit hospitals that mandate this. So in some cases, your community might have it mandated, and in others, it might be something that you do voluntarily, or you may not have specifically a CHA or a CHIP, but you might have something that is like it or has similar, kind of a similar intention. And the idea is that every, let's say, 3 years, the community comes together to assess health needs holistically, right? So what are all the health challenges that are going on in the community? That's your CHA, community health assessment. And then you have the community health improvement plan, which is what is the plan to then address those challenges. Now, if you're an organization that is focusing on reducing youth substance use, and you know that your county is going to be going through a community health assessment cycle that commonly will oftentimes identify substance use and mental health challenges as a priority issue. Sometimes those 2 are brought together, sometimes they're separate. Rising youth vaping rates, maybe. If they have been rising, they may have been going down in your community, but let's just say for the case they have been. And maybe early initiation of nicotine use is a concern. Now, in a county health improvement plan, it'll often include some type of information to address that challenge. Maybe it's reducing substance use, increasing prevention, early intervention, promoting healthy behaviors among adolescents, though it does not always, right? And sometimes if it doesn't, that is a place where your organization can step in to try and help inform that plan. So what you want to do in this case, in terms of communicating value, is to help collaborate and provide data to inform the community health assessment process. So for those of you who are working out there in the community and know that your county is engaged in this in some way, it may be in your interests to, and for those in the interest of those that you serve, to find some type of way to communicate with those who are creating these community health assessments and ensure that prevention is included in them as an important priority. And that's our responsibility as, citizens of a community. A lot of times these are sort of more public sector coordinated orchestrated events. Sometimes they'll even have very formal processes for community inclusion, whether it's town halls, focus groups, gathering sites, task forces. There's lots of ways that your organization can be connected and involved in that planning process. Sometimes they'll even open things up for public comment, where you can go and they say, here's our plan, we'd like public comment. You can go in and add public comment to that plan that talks about maybe what you're seeing that could be reflected or maybe not reflected in that community health assessment, to help in turn shape how that community understands the problem that you're interested in within the broader scope of health challenges and needs in a community. So you want to be collaborating. You want to be providing data to inform that community health assessment. And you want to be in the conversation, and to use the Hamilton phrase, in the room where it happens, right? The leading strategic priority discussions for the CHIP. And that's a really important advocacy opportunity for your organization, is to try to be a part of that conversation and being that subject matter expert on substance use challenges with youth and the prevention sphere, broadly speaking, so that you can help communicate to the community what you know, so that that information is informed. And I'm not saying that you should go and hijack somebody's planning process and put yours above somebody else's. But really what I'm trying to suggest here is that what you want to be able to do is to be in that conversation and ensure that those who are making decisions, broadly speaking, across your community to health, that they are informed about the particular needs of youth and the importance of prevention. And then, as a result, you're then viewed as that go-to organization to solve some local substance use prevention challenges. And this can have all kinds of benefits. And sometimes it's financial, sometimes it's not. Really what you want to be doing is being that person that somebody's ready to call and say, oh, I know that organization, I know they do good work, I know they're addressing this issue, they can help us be that solution-oriented partner. And being a part of these planning processes helps your organization to be viewed in the community in that way. So youth vaping prevention directly advances county health priorities by addressing identified needs, supporting prevention strategies, and contributing to long-term population health outcomes. This might be one way of putting it all together as you're thinking of a value statement or something to that effect for your community health assessment. All right, last one. So maybe we might try to be thinking a little bit around issues of trust and access, legitimacy, and maybe your audience here is the State Department of Health and Human Services, right? Oh, it looks like my bottom one here came out quickly. But let's say that your focus population is on rural communities, right? In rural communities with limited access to prevention services, they've got fewer local providers, lower social capital, and community resources. I'm giving that as a case example. That might not necessarily be true of your community, but let's just say that, for example, that it is. In this case, what you want to be talking about, how do you position value for your organization, is to recognize and position yourself as someone who really knows the challenges of rural communities. So maybe you know about the barriers with geographic isolation, transportation challenges as people have to drive from one county to another just to be able to access programs or services, and that there's a limited institutional presence. Maybe your healthcare system isn't as well developed, or maybe you have had some hospitals that have closed in your community. Maybe you've had some behavioral health clinics and prevention programs that haven't been supported and have not continued in this rural area, right? So with that in mind, what you want to then try to do is position your organization as this locally embedded organization that has partnerships, schools, faith groups, and community organizations that knows this community well. When you can go to a funder and say, we are one of the best organizations to partner with to work with this particular community because we are here, we've got our presence, and we show up at all these different events, that we are seen and trusted in the community as someone who could actually deliver the programs and services effectively. Maybe you have some different types of adaptive delivery models that are unique to your community. Maybe you do this mobile, or maybe you do this virtual work, community-based and connected with organizations that aren't maybe known to people who are outside of that community. And you find different flexible ways to make that possible. In sharing how you do your work, you're also communicating the values that you put forward and how those values are associated with connections to make the work more effective and more possible than would be done if the work were given to somebody else who's an outsider to your community or your organization. And then you're a trusted organization. Maybe you have some data where you can ask that question, who do you trust? You could ask that question on many of your surveys to get a sense of how well you are trusted and known in the community. And you might even be able to show and compare your trust in you to other organizations, especially outside ones, to be able to make that case that you're a particularly trusted organization in your community. So the key point here is that you're ensuring services reach populations that would otherwise be missed through earlier engagement and consistency in delivery. And to put it all together, you might say, hey, rural-focused, community-based approaches ensure that state prevention resources reach underserved populations, reducing disparities and improving equitable access to services. So this last one here is kind of positioning your organization, again, as that go-to problem solver, but because of your knowledge and depth and experience and engagement with local communities. All right. Now, that was a lot. I gave all 5 examples here. So we'll I'll walk through a few more things here, and then we'll kind of do a bit of an exercise to practice this for yourself. Now, of course, there are limits to this, right? So each one of the things I gave there all had certain assumptions. I used the term "let's say" quite a bit as we were going through it. But I want to be clear that it's kind of okay to do some estimating. I think sometimes we tell ourselves that we can't do it, and the number has to be exactly right. And yes, when you're doing your reports for federal and state grant reports in particular, you cannot lie or make up information. And so I would never suggest that. But what I will say is if you're going to do a prevention program, you should at least have some kind of back of the napkin number of how many people you intend to reach and how many people you hope see some type of behavior change as a result. That's the reason why you're doing it, right? If you don't have some kind of number to estimate that, then how would you know if you're being effective, or how can you really say that this is going to be a useful thing for the community to do? Same thing with naloxone. If you're distributing much naloxone, you should have at least an estimate of how many of those kits are going to be used and how many of those kits are going to bring about a reversal and potentially save someone's life. So by using estimates, what you're doing is you're trying to take something that is a bit broader, a little bit harder to understand and make sense of, this topic of prevention, right? And bring it down to very specific situations that people can wrap their hands on. Oh, I understand it because I love this prevention program because I've got 5 students who might have been suspended, but they weren't this year. I understand this program because we haven't had an auto accident involving youth in 3 years. And that's because of the great prevention work of this organization who's been getting the word out about that. Our events around, prom and homecoming have been much more effectively run and much safer for our community because of these prevention efforts, right? When you can get it down to those very core things for people, it resonates in ways that numbers on a spreadsheet just simply don't. So yes, they are estimates. State that they're estimates, be honest about it, right? And say how you came up with those numbers. But your argument strengthens when you can gather that local data to support and research and be able to show that in meaningful ways that resonate with people. Now, not all approaches will resonate with the audience, and so you'll have to kind of tailor your approach a little bit. Some people are going to probably be turned off by using cost estimates when we're talking about people's lives, right? And I gave that example in the caveat and the problems and limitations of that up front. So it's a part of you having a good relationship and knowledge with the potential funders and stakeholders in your community to know what types of arguments are going to resonate and which ones won't. Okay, now I've gone through all 5 of these: economic, risk and consequences, system impact, strategic alignment, and community, and equity, trust, access, legitimacy, all those kind of different pieces. What I'd like for you to do is to go ahead and use our Slido again here. You can use your phone to do a picture to use the QR code, or just go to slido.com and enter in that number 2131653 with a passcode that's written. And go ahead and respond real quick. Of these 5 ways, which one do you think you want to improve on the most? Which one do you want to get better at and use in the kind of reporting and work that you're doing? And let's see some responses come on in. We got 3 so far. Folks are kind of making their way over to Slido or using their QR code. And we're seeing some variety of options come in here. We're seeing economic, that cost and ROI, currently at the top here. But we've got the horse race, it's moving. It's people that vote, and the bars go up and down. Looking at system impact is getting a lot of votes. Interesting, okay. The reductions in burdens on staff time and resources that are being used to respond to challenges that could have been prevented in the first place. Good examples here. System impact, economic, risk and consequences, priorities. Some good examples. We've got 20 responses here. We'll keep it open for a little longer to see what comes in. System impact staying at the top. This is fascinating. I was very curious to see which one of these would resonate the most with you as I was putting it together. I was wondering, I wonder which one that they'll be most interested in. Okay. Well, we've got about 25, so that's about half of our group today. Well, 26, there we go, it's moving up with voting, but I suspect it'd probably stay this way if we got everybody a chance to vote. I know some of you are probably unable to vote or driving or something along those lines, but so stay safe out there if you are and you're listening in. But here you've got, it seems like that this system impact seems to be one that resonates the most. And I see Salvador, you mentioned that. Too bad you can't click more than one. I did want to force you to choose one because this one I wanted to get a sense of what was the most important, right? Though I suspect many of you will probably use more than one of these options as you're thinking about positioning your organization for funding moving forward, right? Awesome. All right, well now it's your turn to try to come up with one of these things for your organization to try and make that case. Now, at the beginning of our presentation today, I talked about this worksheet, so we've got it right here. Thank you so much, Jason, for dropping that in the link there. That's perfect. You can go to commongoodData.com/prevention. You can just click the link right there that's in the chat, and you'll be able to download this worksheet here. And this is just a very simple worksheet that's going to walk through and give you something that you can kind of write and take notes on. And we're going to go through each of these 3 steps together as a group and kind of share out some of our responses. Okay, so go over to commongooddata.com/prevention, download this sheet. You'll see it. It'll look something kind of like this. You might have to scroll all the way to the bottom of that page because the workshop 1 and 2, or the second workshop's out at the very bottom. So you'll see one button for the worksheet and one button for the slides as well. And so go ahead and click on that button for the worksheet. All right, and let's take a little bit of time going through it. Now at the top, you'll say it says it's a framework communicating your value, and it says use this worksheet to take one outcome from your program and translate it into value for a specific audience. And so the first step is to begin with an output or an activity and identify the audience. So I gave the example there of we serve 200 youth in a prevention program, right? And that our audience is a local community foundation. But you can change that. You can say naloxone distribution. You can say talk it up, lock it up media campaign. You can say, an online new, I don't know, I'm just making things up at this point, right? Any of those type of classic prevention activities here. Oh, a tobacco ordinance. That would be really interesting. If you tried that. I wonder how that one would work, actually. It might be a little trickier because we don't have necessarily numbers on that. But choose one where you got a number of people who are reached or served by some type of activity in step one and what your audience is going to be. Sorry about that. And once you have your response, what I love is to have some folks drop their responses into the chat. Go ahead and put in your responses there. Now, I will say for you as you're working on this, if you're worried about sharing your own information or don't want to, or if you're not sure if you have that information right in front of you right now, that's totally okay. For now, you can just invent numbers because the point here is not the numbers themselves, but rather the thought process and the exercise that we're going to go through to communicate. So if you want to make it up, you could also just use that example there that says 200 youth in a prevention program. Maybe you want to name it specifically like Too Good for Drugs, Botman, Life Skills Training, or any of those types of keeping it real, all those other different types of programs out there. And then let's see some in the chat. Would love to see kind of what you guys are thinking of, the types of programs here. Drops a few in step one in the chat here. Expect many of you are diligently working, which is good. Let's see some examples in that chat so we can have a couple examples to walk through. Some that you can share out so other members of this call can also learn from you and kind of learn from the perspective that you're taking, the work that you're doing in your organization today. And if you have a question about what you're trying to tackle on, you can also drop that in the chat as well. Or if you'd like to come off mute, you can come off mute and ask me a question about your approach here if you'd like to as well. All right, we're getting some responses coming in here. This is looking great. So Johanna writes, we give overdose prevention and reversal education to 150 incarcerated individuals, and the audience is the Criminal Justice Coordination Department for the county. Perfect. That's a great example, right? So you've got overdose prevention and reversal education, in this case, pretty much how to use a tool like naloxone or something similar, right? To 150 individuals who are currently incarcerated and could be at risk for either themselves or knowing somebody who might be at risk of overdose. A great example of who you're working with and a great audience as well. Garrett shares serving 450 youth in a problem safety program at a local high school. Perfect, right? You got 100, you got to know the number of students that are in that school, and here's your intervention. And you might have, you're right there, I'm assuming maybe you think that you would have the local high school as the audience, but if not, you can mention that too if you have a funder or a stakeholder that you're trying to seek assistance from to be able to support that type of initiative. Lydia mentions hosted Talk Saves Lives suicide prevention training to 35 community members. Awesome, right? So you're going to offer this training. It's going to 35 community members. Perfect. Implementing a community-based prevention program serving 200 at-risk youth using an evidence-informed curriculum. Excellent. So addressing factors for early substance use and building protective skills for long-term well-being. Brianna, very good example there. See if you can add into that too, add the audience that you're going to try to communicate with to talk about and ask for support for that type of a program. And Christy mentions teen mental health first aid training. So you got high school students, good. to strengthen it, try to add a number in there so that way we know specifically how many students. And if you can just use an estimate for now too, like 200 or 300 or 500. But these are all some great examples, folks. I love it. We got great information coming in here and some good examples that will work for it. So we've got 2 more steps. Let's go to our second one. Here is step 2 is choose a value lens and then translate it to value. Now for in this section, all you have to do is choose which one of these 5 you want to use. Now, again, to review, our economic one is looking in terms of cost or return on investment. So what's the return on dollars invested in your program? The risks or consequences. So what costs or risks are you trying to avoid? The third one is system impact. So what is that burden that you're trying to reduce on the system as a whole? Given how our poll answer went, I think maybe many of you might try to choose the system one. The fourth one being strategic alignment. So how does your work align with some of those strategic priorities? How do you position your organization as being ready to solve that, right? And then community inequity. How is your organization positioned to be successful? Now, of course, in reality, your organization might work across more than one of these 5. But for today's purposes, just choose one of them. Go ahead and write it on your worksheet and drop it in the chat so we can see what people are going to be working on with their examples. Okay. We had a few more examples from our last one. Imaging mentions around 400 students for Too Good for Drugs, 130 for Too Good for Drugs and Violence, and 150 in life skills preventions. That's awesome. Excellent. Salvador mentions prevention classes to 6,000 students. Excellent. For those 2, try and find, who do you want that audience to be? So is it a community foundation? Is it a program officer at a grant stream that you typically apply to? Is it a county commissioner? Is it somebody in your state department of public health? Is it somebody who works at your United Way? Is it a talk that you're giving to a Rotary Club? And all those, try to think about who's that specific audience that you're going to have in mind who could potentially fund or support your work as you're improving that there. Okay, so we got a couple of answers coming here for step 2. Garrett shares risks and consequences. Excellent. All right. So those costs and risks that we're trying to avoid here. We have another one for a return on investment. Another one in risk and prevention of consequences. Those are good answers. Let's get a few more in there. I'd love to see, what are you thinking about? What are some of those value lenses and how you might use that in a way to address the or gather support for what you mentioned in step 1. See a few more responses here. Oh, I'm getting ahead of myself here. All right, we've got a couple more responses in here. More risk and consequences. Excellent, perfect. That seems to be a big one. What's nice about risk and consequences is that as a value positioning, it does resonate because a lot of times when we have particular risk and consequences, especially if your community has unfortunately experienced some cases that maybe be more high profile cases or things that were in the news or something that affected a particular school community, for example, with youth, those risks and consequences can be really, really important and resonates with the community that really wants to see those particular challenges addressed. And it's a good place to begin because sometimes that can be one of the more straightforward ones when it comes to trying to measure it, because we may already be collecting information or data about that issue or problem in the community. A bunch more on risk and consequences. Excellent. We see a few more on systems, reducing costs of overdoses in hospital systems. Excellent. Tori mentioned something really important here. It says, hey, can you choose more than one? I think the audience will really impact what value I chose. That's exactly right. And I should have mentioned that as we're choosing which one you're going to do. If you're choosing up here, if you say, local United Way, or you say DFC program officer at the federal level at SAMHSA, or you say, county commissioner who's working on behavioral health issues, that's going to impact what you choose because your audience is going to may or may not resonate with all of these 5 value situations, right? So the whole reason we choose our audience first at the top is that you want that value lens to match what that audience is really interested in. So I'm really glad, Tori, that you brought that up. Now, in reality, of course, you can choose more than one. And if you want to do more than one at the same time while you're doing this exercise, you can. But I want to make sure, I know it's a lot of work to do to try something for the first time. So I do want to give people 2, maybe just start with 1 for the exercise. A few examples, there's community and equity and economic good that Salvador mentions. Excellent, some good examples here. I love it. Okay, now we've got some good examples now of our outputs or activities. We've identified audiences. We've chosen a value lens. Let's now work over here to step 3. And here's where we want to try to translate that into some value. So let's put together 1 to 2 sentences that express what value might look like for your activity and audience. You can use, of course, estimates as needed, as I shared previously. There are limitations to that, but for now, go ahead and use some of those estimates. If you did this prevention program, how many particular things would you prevent from occurring, or particular if you're doing risk or consequences, or what sort of expected behavior change do you anticipate seeing? And how does that get linked to something that is valuable, whether it's an economic return in terms of the amount of money that your organization or the society and community is going to save. Maybe it's a consequence that's going to be avoided, like fewer auto accidents or fewer behavioral problems, fewer dropouts at school, fewer overdoses, any of those lists of things that could be occurring. Is it system impact? So maybe you're reducing certain hours of people's time that is going to be spent doing things that maybe they would prefer not to be doing, or maybe it's reducing just congestion and log. Maybe you're reducing ER wait times because there's fewer people going to an ER. Maybe you're reducing the stress on recovery programs because there aren't enough seats in that existing recovery program to meet your current need, but you're preventing some so you can free up the recovery system in your community to be more effective in serving those who have gone through treatment and are in recovery. Sorry, you could just treatment or recovery in the example I just gave. Or is it strategic alignment, right, around some of those priorities? How can you kind of position your organization to meet a specific audience's priorities that are there in your community? And then again, at the very last one, kind of that trust and access and sense of connection to community. How is your organization positioned to be successful, and how does it know your community left and right better than others do? So take that and kind of translate it into value. I've given 2 examples here that you can look at. So the first one there says our naloxone distribution program results in 350 overdose reversals at a cost of about $2,000 per reversal, avoiding an estimated $2.6 million in hospitalization costs, generating $3.75 in value for every dollar invested. Again, that's an estimate. Those that I came in, but that was kind of the same example I gave before. But that's what you want to look for, a sentence that kind of is written like that. You can try another example here. This program reaches over 500 rural residents annually through community-based delivery, increasing participation in prevention services by an estimated 20 to 30%, and reducing geographic disparities in access to underserved areas in our area or county. That's kind of that last one there, focusing on community. So go ahead and try to put 1 or 2 sentences together. How would you do it? And again, if you need to make up some numbers for now, you can. Because you might not have all that information in front of you. It's most important is the exercise. Joanna says, I need some coffee for all this math. I know it's true. It's truly cruel for me to be giving you a dense and heavy exercise like this one, especially in the afternoon for those of you who are on the East Coast. So I appreciate you hanging in there with me on this one. But I'm going to give you all about 1 or 2 minutes, and let's see a few examples drop in the chat. All right. Now I'm hoping with a little bit of quiet, without me pestering you with more examples, that it's giving you a chance to take a couple of attempts at step 3 there. I'd love to see some examples. So if you're working on it, we'd love for you to share it with the broader community here so that we can learn from each other and see some examples. and I can give you some feedback on ways to improve it or some things to think about as you're putting it together. And of course, the whole goal with this is not so much that one or two sentences is going to all of a sudden change the funding direction of your organization, but it's really more the exercise of thinking, because you're going to use sentences like these in the next grant proposal that you put together, in the next slide deck that you share at a conference in your community or a local Rotary Kiwanis Club, or maybe you're meeting with the United Way and you want to have that conversation about the important work that you're doing. Or maybe you're even just reporting back to SAMHSA or CDC. You want to communicate to those grant officers the type of impact of the work that you're doing. So again, it's really about kind of getting it into our muscles, how we can talk about that impact in terms of value. All right, so we have a response here from Salvador. Excellent. He says maybe a 3% reduction in a certain topic in a local region because your county has a massive increase in numbers of teen pregnancy or STDs or something like that in a much larger area or something like that. Very good, right? So you've got that 3% reduction. So you're looking at getting to a numeric indication of a particular challenge that you're trying to address. So a good example there. And I think a lot of times in prevention, sometimes those numbers of what we're trying to change are kind of small. You know, if you looked at the data, for example, on things like 30-day use or access in the home, or peer or parent disapproval of use, for example, many of those common indicators for particular substance use surveys and things like that, you'll see that it's a really big deal when you can move it even 1 or 2 percentage points, right? It's like, whoa, that's actually a huge change. And so a lot of times in prevention, we are dealing with making changes on the margins. You know, I was looking at some research on positive social norms campaigns. And, you know, for most cases, positive social norms campaigns might not address and change, you know, hundreds and hundreds or large percentages of youth perceptions or behaviors. But they're working on the margins with a couple of youth. Out of 100 youth, maybe 3 or 4, you know, change their opinions or attitudes because they saw that particular message. And that's a real prevention win. And as you build up that 1 or 2 percentage points changes every year, over a decade or more, all of a sudden we see a huge historic change. And ultimately, if we look back at changes in combustible cigarettes, for example, or changes in alcohol consumption among young people, it's been that compounding, you know, it's almost kind of like a compounding interest thing. I just realized it's kind of like, I've never made that analogy before, but it might be kind of like, you know, in the same way you put a little bit into a retirement account over time, it builds up into something big. The same is true for prevention. A little bit of change with each intervention, each program that you are engaging in builds up to really this great change over time. We got a couple other examples in here. Johanna writes, the program results in 85 overdose reversals within the jail and 20 overdose reversals for newly released individuals, thus saving taxpayers over $1 million in hospitalization costs, ambulance, etc. Nice work, Johanna. I love it. And you did it. Maybe, I'm not sure if you had coffee or not. Maybe you got to run over your coffee pot and fill up before you're coming back. But that was a great answer, right? And certainly you're using estimates here. But as you kind of work on it more precisely, you can get some good ideas about what those numbers might look like. Christy shares, teen mental health first aid reaches over 200 youth during the school year, increasing behavioral health awareness by 20% and decreasing 988 calls by 5 to 10% across our rural county. I love it, right? And 988 calls is something you could very easily measure, right? Because that's something that I'm sure your 988 team probably has some data on how often they get calls. A lot of times that's the first data point that people look at when you're experiencing something, a big change in the community like a pandemic or something. It's 988 calls, because that's when you know when people are running into challenges. So great example there, Christy. I love it. Kathleen says, is it good to have someone respond to our estimates? Often schools are looking for projects for their graduate students, and this can be a great match. Yeah, actually, sure. You know, if you can partner with, you know, someone to help put some of these value statements for you and try to put together some estimates on what would be a good way to communicate the value of your work, I think that's a great idea. We're always looking for partnerships, right? Well, some awesome examples here. I encourage you to kind of continue to think working on them. If we have a few more in here, I'll provide some feedback. So if you're still typing, finish your thought, but we'll go ahead and continue towards the end of our presentation. But I'm hoping that this has been a useful exercise for you. It's not an easy thing to do, to be able to try and make that jump from what you do to the impact you have to the value it brings to a community. And going through this, even as a simple exercise, was challenging. But as you continue to sort of develop that muscle, it'll give you opportunities to think about and frame and talk about the work that you're doing in new ways. So I encourage you to keep trying, even if it's challenging and it's an afternoon and you still need another cup of coffee. All right, so we've gotten some examples there. Let's think about how we might make this real. So I talked a little bit again about this funding piece, right? The bridge, and connecting your impact to value through storytelling, testimonials, advocacy, thought leadership, grant writing, donor stewardship, all those things that your organization is probably doing to some degree. But how can we make that connection a little bit closer so that when we look at the types of interventions that you're doing to prevent substance use challenges in the community, that immediately gets linked to one of these streams out here that you use to drive funding for your organization? Well, I'd like you to think of the system that drives your funding as an ecosystem. I suspect that many of you who have been doing prevention work for a long time would probably say, especially because of how many people shared that state and federal funding were the primary sources of funding at the very opening part of this conversation, that your direct funding requests, the grants that you submit to SAMHSA or CDC or to Department of Health at the state or local level, is probably the primary way that you're trying to communicate value and receive the funds that you need to be successful. And maybe some of you do a little bit of donor stewardship, relationship building. Maybe you have some Giving Tuesday campaigns. Maybe you're having conversations with, some states have something like a local ABC board that might, in some cases, are mandated by statute to support prevention activities. But you might be able to, connect. And for ABC board refers to Alcohol and Beverage Commission, but sometimes there's, alcohol sales or can be used, and the funds and proceeds from that can be used to support prevention efforts. Now, when you've got these direct funding requests, we're kind of used to that. But I think what I'd like to challenge you to think about are these second and third bullets, where we say, okay, the work that we're going to do to raise the funds we need for our organization to be successful is going to go above and beyond the grant application. So a big piece of this is thought leadership. And that means volunteering to go to, I kind of shared the example of the Kiwanis or the Rotary clubs, or even if it's just like a chamber of commerce that has a local nonprofit group that gets together. Go attend that meeting, meet those other folks, and talk about the important work you're doing. Offer to sign up and give a presentation. A lot of times people are actually looking for presenters and they just need someone to come and talk at the next session, and you can solve their problem by being that person who can take care of running the meeting for them, right? Start some places small, start with places that you know, and over time, each time you go out and share another presentation and talk to another group and communicate your message and the work of your organization, you're going to get better and better at communicating the value that you bring to others. Advocacy, and advocacy includes things like, in the sort of electoral process that we have in our democracy. But I think that advocacy is much broader than just simply elections or campaigns. And start to think a little bit about just simply getting coffee with one of your local officials or a quick 30-minute Zoom call. They're surprisingly easy to reach out to. Sometimes we think if your only interactions have been at the federal level, you might say, I don't know, these people who run our government are far and distant from me, but our democracy is designed that most of the people that you elect are actually in your neighborhood. And it's just getting a chance to know them and to talk about the work that you do, which can be so important. And then also this communication and narrative aspect work. So what is the story that you're trying to tell? And that story can be of an individual person's change, an individual person's transformation that came as a result of the programs and services that you offered. But you're also talking about a broader narrative or arc about how your organization fits within people's public understanding of what the particular challenges in our community are. A big narrative that the public very well understands, maybe thinks a little differently about in terms of what the challenges are or how you might respond. But the opioid crisis is something that deeply people know about, that is relevant and is something that people are thinking about. So if you can kind of tell the story of your organization and how it fits and as a response to this particular challenge and crisis that we've experienced in our country, it helps people understand who you are and where you fit. and then what is that value that you're bringing to the community? And then certainly with testimonials, and this is examples of people who've gone through your programs and services and had some particular change. Whenever that happens, building and documenting processes where you can share that and communicate it out. I was talking a lot about numbers today in the examples that I gave, but there can be lots of good examples of testimonials of individual lives that have been changed that can still communicate many of these 5 value examples that I gave in the worksheet. And lastly, having a strong communications and marketing team that kind of helps support all of those things. The reality is the second and third bullets here are sometimes ones that were more, maybe we don't always put together, or maybe we say we'll get to it when we have time, and we focus on the grant writing and maybe direct asks from steward and from donors. But it's a good idea to recognize that those people are going to see your organization in a different light if you've got these other pieces going on, if you're well known in the community, so that they can understand who you are before that petition for support even shows up on their desk. Right? And so the key here is that you want to make sure that if you're going to be securing funding, or you desire to secure funding, you have to not only show that impact in the way we talked about and that value, but be relentless in communicating a consistent message across all these different challenges and platforms. Now, I know we are getting close to the end here, so we got about 4 minutes left. I have one last poll. We probably don't have time for that, so I'm going to skip this one here. And I'll actually just turn it over for questions. So, Angelica, thanks. You just dropped that the eval link in the chat. So for those of you who are on this one call, we'd love for you to complete that evaluation. It's so important for the PTTC to have good feedback on how these sessions are run and help design newer and better ones for you each time that you come. Again, if you have questions about this, you can come off mute or drop questions in the chat. I'll be happy to answer. You can also contact me directly at drew@commongooddata.com. And I have the link to the scorecard in there as well. And I'll drop in the chat again that link to the resources for today's presentation. But thank you so much. I'll stop presenting and talking here and just be open for questions. All righty. It sounds like you guys have some real clarity on how to do this. So I'm hoping that that means you guys can just walk away with this and perfectly communicate that value, right? Well, we'll go ahead and wrap it up. Angelica, I might turn it over to you if you have any kind of final thoughts from PTTC before we wrap up our webinar today.